Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to From Hair to There, a podcast about alopecia, where we bridge the gap between patients, healthcare professionals, and you, our listeners. We bring you diverse alopecia areata stories from around the world, highlighting the challenges and successes of living with alopecia areata and reminding you that you are never alone in this journey. Hair loss isn't just physical, it's emotional, mental, and even spiritual, and we're here to discuss it all. I'm Adam Kegley, Manager of Global Partnerships at Global Healthy Living Foundation, and your co-host for this episode. Today, I'm excited to introduce my fellow co-host, Supriya Surrender. She is someone who doesn't just speak about alopecia areata, she lives it and is a fierce patient advocate.
Thank you, Adam. It's been quite the journey for me as an alopecia areata patient advocate, and I'm here to share it all. I believe that every alopecia areata patient has a unique story, and by sharing ours, we can inspire, motivate, and uplift each other. Whether you're an alopecia areata patient, a caregiver, a medical professional, or someone just wanting to learn, this podcast is for you.
So tune in and let's embark on this journey from hair to there.
We have three wonderful guests with us today. Dr. Julien Ringuet, dermatologist from Quebec City, Quebec, Canada. Dr. Laurie Ferguson, clinical psychologist from Tapan, New York in the US. And Nazin, alopecia patient and advocate and student from British Columbia, Canada. Welcome, everybody, and thank you for joining us today. Why don't we start with each of you telling us briefly why you're looking forward to being with us on today's episode. Let's start with you, Dr. Ringuet.
Thank you, Supriya. So it's my pleasure to be here. As you mentioned, I'm a dermatologist in Quebec City, Canada. I'm also a trialist, which means that I do a lot of clinical trials for new therapies, especially alopecia areata. And we do have some new therapies that have great efficacy that are actually already available in the US, indicated by the FDA, and they are coming in Canada pretty soon.
That's very exciting. Up next, Dr. Ferguson.
Hi, Supriya. Thanks for that invitation. As you are a fierce patient advocate, I am a fierce advocate for patients living with chronic diseases. And so it's a way to provide support and encouragement and good education through this. And so I'm just delighted to be here with you all.
Thank you, Dr. Ferguson. And now Nazin.
Hi, everybody. My name is Nazin. I have been dealing with alopecia for more than 3 years now. And it was about last year that I completely lost all my hair. So I don't have any hair growth currently. I don't have any lashes, eyebrows, or any scalp hair as well.
Thank you all so much for joining us today, and thanks to Supriya for getting us started. I think to kick things off, Dr. Ringuet and Dr. Ferguson, I'd like to ask just a couple of questions, as you're both healthcare providers, about working together for alopecia areata patients. So I'll start with Dr. Ringuet. Where do you start when you're losing your hair if you're a patient? And I guess a follow-up question to that would be, should a mental health professional be included from day one? Are dermatologists recommending health professionals as part of treatment?
All right, so good question, Adam. Of course, when those hair are starting to fall down, there are some questions that are coming up. So you're in some distress, definitely, because it's an unusual situation. The important thing to remind here is that the fact to lose hair, so let's say alopecia, which is a general term that includes many other diagnoses, needs to have some details on it, meaning that you can lose your hair for different reasons. There are some that are, let's say, hormonal, some that are post-stress, which are called telogen effluvium, and they are all very different from the alopecia areata, which is an autoimmune condition that, let's say, attacks the hair. So the diagnosis is still important, and that implies either to have your family doctor on board, so you need to maybe talk to him first, or either your nurse practitioners. Some of them are able to make the first diagnosis and initiate, let's say, basic treatments. They can also refer you to a certified dermatologist that can afterwards take on the rest of the treatment. To your question about the psychosocial burden of disease and do a mental health professional be implicated from the start, That's definitely important. And again, it's patient dependent. So you definitely should talk about this with your medical provider. So if you feel psychosocial burden, psychosocial distress, and of course, it's a new thing, so it would be normal to feel those symptoms. Then it would be indicated to have someone to support you even before the official diagnosis is confirmed by one of the medical providers. But again, it always should be patient-centered.
I think that's a really good point, Dr. Ringuet. It really depends on the patient, being patient by patient, what that exact patient is feeling at the moment. Maybe it's completely overwhelming, or maybe at first they seem to be taking it in stride. And I think the follow-up question then for Dr. Ferguson would be, considering what Dr. Ringuet said, do you see healthcare professionals working closely already together on issues like this with alopecia areata patients, or do you think they should be working more closely together?
I think there's always room to work more closely together. I think we tend to be a little siloed in our caregiving. And of course, there's in the United States, a lot of HIPAA regulations about that. So waivers have to be created for professionals to talk to one another. So there are some barriers to that. But I think that one of the things this podcast is really lifting up is the team approach offers the best support. But it does fall on the patient to put the team together most of the time.
Just a quick follow-up there too, Laurie. That's a really good point. Dr. Ringuet, is that the same case in Canada as well, that the onus is on the patient to put together their team?
So it depends, meaning that some people that are used to working with those skin diseases that have a psychosocial aspect, distress, or even just the severity of the disease, then sometimes we have those close contact with psychosocial therapists or even psychiatrists sometimes, because those diseases can be very debilitating in some aspects. So we do have some links, but that's not probably true for every prescriber, especially in the first line. So there's a part of this burden that goes back, yes, to the patient. And so this service, if it's privately covered, there's a responsibility by the patient to ask for counseling and psychosocial support. But sometimes we do use public coverage. It takes a little longer, but we definitely can access those services for our patients.
Thanks for that.
Thank you both. I love that because alopecia areata, I feel like, especially when you're first losing your hair, you can feel so alone in the struggle. So I love that you're both promoting this team aspect to care, because the more people that you have that can get behind you in this, whether personally or medically, it really helps you along the way. Thank you both for sharing that. And with that, Nazin, my fellow alopecia areata warrior, when we think about this team-based approach to care, we almost start to create a toolkit of people that help us through this journey, right? And so going beyond medical professionals, who else has helped you and who else is part of your support team, and what does that look like for you?
Yeah, for sure. I think one of the best people in my life that was able to actually help me get through this condition was my family and then my friends. My family were the ones that actually pushed me to get professional help for getting a therapist, psychiatric help, and to be able to get on medication for just antidepressants, because during the time that I was losing my hair, I was in very bad depression mode. And unfortunately, I wasn't able to ask for help when I really needed it. And so it was probably after 2 years of me going through the constant losing and growing my hair that my mom was like, you really need to get some help right now. And I honestly, if it wasn't because of her, I wouldn't be able to be here right now. And my friends' supportive behavior were always with me, and they always supported me when I needed to talk to them about the differences in the way I looked. When my hair was falling, I really was embarrassed by the way I looked. And that was something that really was very hard for me as a young girl living in Canada. And just in general, it was very hard because I wasn't used to the way I look, and I had to do a lot of things to cover up my bald spots. And even after I lost all my hair in the beginning, it was very hard for me to go out because people would just stare at me. And if it wasn't because of my family's and friends' help, then I would not be here right now. So I think having that team to be able to help you just get through the things that you need to just talk to them about. It's really important. And I believe everybody should be able to still speak up, because I wasn't able to. And that was something that really hurt me. And if I did it sooner, that would probably be a lot better for me. So I would really, really recommend everybody who is going through that to speak up to your family, to your friends, to professionals, because they know how to help you, and you never know what they can offer you actually.
Thank you. I'm so happy that your family and friends were there for you. I know that can make, such a big difference in how you experience this. And there's so many emotions that go with this. So it's wonderful to hear that your network had that level of support for you.
Yeah, for sure.
It really is. And actually, I'm really glad that you discussed that, Nazin, because it actually makes me think of a follow-up question for Dr. Ringuet that ties to this sort of sense of urgency that alopecia areata patients may feel when they're dealing with an unsupportive person, which is an urgency, I think, that's connected to needing to feel supported, and the loss of the expectation that you would be supported by someone who's close to you, perhaps. And even that leads, I think, to my point of the urgency around getting diagnosed. And I think in that regard, Dr. Ringuet, I'd like to ask you the question that's, how do you actually address wait times for appointments for a specialist when time sometimes is literally of the essence for someone whose hair may be falling out in clumps as we speak? I know in Canada, patients can sometimes face longer waits for specialists. So I was wondering if you could talk a little bit about how to address that, or even just perhaps, they need to come in and see someone because they're having an issue with an unsupportive person.
You're totally right, Adam. So yeah, the time to treatment and time to specialist is quite important, especially for rapidly progressing disease. So the efficacy of the referral pathway is kind of critical in that sense. You're also right that there is some differences in terms of the health systems between country, between continents. So again, that should be kept in mind. But first of all, so if you need a referral to see a hair specialist, and that's pretty much a dermatologist in general, so to have more info in the referral notes definitely help to prioritize the case. And that includes the severity of the hair falling down, the rapidity of the progression, the psychosocial burden associated with it, and all those details help the medical provider to then classify everyone in terms of priority and see those patients more quickly. There's also this difference between, as you mentioned, private and public coverage. So most private practices see those patients pretty fast in the dermatology field. But when there are a lot of details, you can also be prioritized to see a dermatologist when the referral is sent on the public space, which is mostly the case for Canadian patients. So it's just truly important for the person that makes the referral to know well the system and who takes in charge those patients.
Thanks so much for that. I think it's really good points all around.
And actually, on this point, I wanted to ask a question to Nazin. So your story is very touching, and you remind me of many of my patients that I've gone through the exact same pattern as you did. So we're going to talk a little bit more about hope and all the different treatments that are coming. But I wanted to know, so what kind of experience did you have in the regard of managing through the healthcare system, and who did you see at first, and were you satisfied with your first encounters?
Yes, thank you so much for asking me that question. It is actually very important to talk about my experiences, I believe. At first, when I started losing my hair, I didn't know what was causing it. So my mom took me to my family doctor, and that was back in Edmonton, Alberta. And my family doctor, when he saw that, he assumed it was alopecia. He didn't give me an actual diagnosis at first. And they sent a referral for me to a dermatologist. And during the 3 years I've been dealing with my hair loss journey, I have seen probably more than 4 or 5 different dermatologists in this whole thing. And honestly, I would say that it did definitely take a long time for me to be able to see the specialist for my condition. And for different medications, I was seeing different dermatologists for that as well, because some dermatologists did not do that medication specifically. And I would have to get referral for another medication and another dermatologist. And talking about my experience, it's about how I truly felt with the healthcare system in Canada. Unfortunately, everything was very slow in progression, but I was losing my hair very fast, and I wasn't able to get the help that I really needed, even from therapy, from a psychologist or a psychiatrist. And it did definitely take a long time for me to be able to see any professionals. But when I was able to see them, definitely they put me on different medications, which was slowly helping my conditions, but unfortunately didn't do anything for me because all the medications were different. And of course, they have different effects on everybody's body. For me, the last medications that I had to do, it was very slow in the treatment that I could not take it anymore. So I told my dermatologist that I need to stop this because it's making my mental health worse, even though it could possibly help me with gaining my hair back in the hopes of gaining my hair back. But in reality, I was in a very bad situation. I was depressed, and unfortunately, there was nothing else that I could do. So I had to stop the medications that I was taking.
Good. So are there things you wish you would have had from your medical support team to, a different approach from your team?
For sure, especially with the last dermatologist that I had to deal with when they were the ones that saw how badly I was progressing with my alopecia. I had a lot of hair in, I would say, 2022, end of 2022. And by the beginning of 2023, I lost everything in the span of 1 month, actually. And they knew that I was going through a lot of different things, but instead of helping me, it was just very slow for them to be able to get me help. And what I really wish that they did is that they would at least show me that they cared about my condition, because when I was there, it was really sad because they would actually bring all their residents and medical students and they would talk to me every day, every single time I went there about my condition, and I had to explain to them every single time. And I felt like I was actually a lab rat, honestly, even though it's not a very good thing to say. But unfortunately, I didn't feel like I was cared for. I felt like I was like just a research thing for them. But I was there, I was real. I was going through all the emotional things. I was going through all the physical things, and I wasn't able to get the help that I needed, even though I asked for them. That time I did ask for help. I didn't want to lose my hair, but I knew that they can't do much for me. But at the same time, if they did show that they truly cared about what I was going through, it would have been a lot better for me just emotionally.
So just emphasize again on the importance of, yes, taking care of the disease. And sometimes, as you mentioned, some medication have efficacy, but it's not all patients that are able to respond to one or the other therapy. But other than the disease, there's, again, the person, and always treat the patient holistically is an important component to it, definitely.
Dr. Ringuet, I actually wanted to ask you and Dr. Ferguson a question. If a patient had a poor experience with their doctor or care team member, how can they best advocate for themselves, or what should they do to seek for a second opinion as well? And if there is also a therapist that they should talk to, and if they're not listening to them, what is the best advice you can give them? Dr. Ringuet, we're going to start with you, if that's okay.
Yes, of course. So, as you mentioned, the link between the patient and the prescriber and the doctor is really important. And if you feel like there is something missing or therapies are not working, the first step would definitely be to speak with your main doctor, express your feelings, express the way you understand your disease and those treatment. And it's always reasonable, to ask for a second opinion to your practitioner. It just, again, needs to stay in the polite and respectful way. And all of those doctors out there that are managing those harder cases of alopecia areata, because we're talking about this now, it's always going to be their pleasure to give this second opinion if ever needed. So there's no problem on that point to discuss either the disease burden or other therapeutic options.
And I would echo that as well. Research shows that the most efficacious part of therapy is the relationship, not the style or the technique. And so if you don't feel like you're having a relationship with the person you're seeing with some of the most intimate things in your life, you don't feel like they're really listening or they care or that they get it, it really is time to move on, because the relationship is what makes the difference. And what makes me sad about this conversation is this is yet another burden on the patient. So I would really encourage you when you're looking for a therapist or you're looking for a second opinion to look into the community and see those others who you share this with. What would they recommend? Who do they know? To get referrals from people who seem to get it, seem to be a good fit. But the fit and the care is the most important part of the relationship.
Thank you. Before I get to my question, I just wanted to add something. Nazin, I just wanted to say thank you for sharing your experience. I can relate to you so much. I lost my hair in a 3-month time span in 2015, so I understand that feeling. The difference is I didn't have to wait as much as you do, and I honestly don't know what I would have done if my hair is falling out in clumps and I keep getting told to wait, whether it was for an appointment, whether it was to see the treatment work. And I just really think it's so important for doctors to show compassion in that moment. And I wish you had that in that moment, because I remember crying in my dermatologist's office so much because it was the one place where I felt like I could actually be truly open about how I felt about what was happening to my appearance. And I remember my dermatologist putting his hand on my shoulder and just being like, it's okay, like you can cry. There's lots of tears in the hair clinic. We understand. And I wish you had that too, because you deserve to have your emotions acknowledged along with what was happening physically to you. So thank you for sharing that part of your story.
Yeah, of course. I definitely feel for you as well. Like, it's definitely such a really hard thing to go through, especially doesn't matter how young or old you are, just because you're a woman and there's like that expectation for you just as a woman in this life. So just going through that whole experience is just very hard. And I really wish I had that experience too, like just being able to be comfortable in the doctor's office, to be able to just cry and just let my emotions out. But unfortunately, I felt very uncomfortable in the whole situation and I never felt like they were there for me. So I didn't really want to show my emotions at that time. So I would go home and cry alone.
Well, you have a friend in me now, so you're never alone in this.
Thank you.
Okay, so my next question is actually for Dr. Ferguson, and it's actually related to stress. How do you suggest patients manage stress? And I ask this because something that many of us in the autoimmune community often hear is that stress can cause autoimmune diseases to flare up. And that notion alone is a stressor in itself. The fear that your stress can make your hair loss worse, essentially. So how do we manage that when it's compounded by more tangible stress that we experience day to day, whether personally, professionally, other? How do we mitigate that compounding effect of stress and fear of stress with the end goal of, keeping our autoimmune flare-ups at bay?
Ooh, what a question. I would think that you and Nazin probably have a lot of techniques that you use, because I think the techniques, while they are general, they are usually, everybody has a specific thing that helps them. But the first thing I hear in your question is, how do we deal with the fear? Because I think a lot of the stress is driven by fear. The fear of getting sicker, the fear of not knowing what to do. And so really the question is, to reduce stress is to really look at what's underneath it. What are the feelings? What's the anxiety? What's the fear? What's the forecasting? And then what are the techniques that you have to stay in the present moment and to allow yourself to be reassured? And, as Nazin said, she didn't have a lot of practice asking for help. I think most of us don't. I think one of the biggest stress busters are the people who love us. And that includes human beings. It includes the animals. It includes the places in nature, all those places where we feel loved or we feel okay. And to go back to those and to use those. And they're going to be as specific as each of you. But to find ways to reassure yourself in those fearful places, I think is the first thing that helps manage and address that stress that, as you say so well, compounds and compounds, and it really starts to run away with you. It all begins to sort of cycle up. So how can you sort of help yourself stop, come into the moment, and just calm your own heart?
Thank you. I think one other thing I wanted to bring up is a lot of times stress is caused by the distrust of what your body is doing. So I'm curious, do you have any tips to trust your body again? Sometimes it can feel so scary thinking, am I going to do the wrong thing that's going to cause my body to do something else that's so emotional for me?
and at a time when your body feels completely out of your control. Something has happened that your body has done that you just don't even know why or what made it happen. So how do you start to feel safe in your body? How do you start to, again, sort of recognize that it's still breathing, it's still digesting, it's still sleeping, it's still allowing you to hug somebody you care about. There are still moments of pleasure, and I think it's to bring to mind those good things along with the scary things. And it's a task to hold those two things, right? There's some really scary things that your body did, and there are also some good things. And to not have all your attention on the scary things or the fearful things, but also to remember the good things. I tasted ice cream today, and it was delicious. I held hands with somebody I love, and it felt comforting. Whatever those things are for you, I think that's one of the ways you can begin to repair some of that trust in your own body.
I love that. Thank you.
So true. I love that too. And it's such great points all around because I think it, again, brings up another topic that Supriya and I talked about just the other day, which is the most predictable thing about alopecia areata is that it's unpredictable. And again, kind of coinciding with that fear that you were talking about, Laurie. And if a patient goes into an office, a therapist's office or a doctor's office, dermatologist's office, and is desperate for something to work to help them, how do you ensure that they also try and set manageable expectations and manage their expectations? And I'd pass that over to Dr. Ringuet first. How do you help a patient kind of manage those expectations?
Thank you, Adam. So yes, realistic expectations are very important. When you look at all diseases that exist, none of them have a 100% strict pathway with whom the disease goes this way and nothing else can happen, right? So there's always a part of uncertainty, and that's true with life, that's true with diseases as well. But the important part is that there is definitely hope. There is a need for resilience as well. And by hope, I mean that nowadays we do have way better therapies for our alopecia areata patient than we did, let's say, 10 or 15 years ago. And the other important part is that most of the patients that have alopecia areata have limited disease to 1, 2, or a couple of spots. And with treatment, it resolves. And most of the time, it doesn't recur. There are other people for who the disease progress, and as Nazin's story shown, it can progress to a quite important extent. But this uncertainty is kind of part of the disease pattern, and my main message would be, again, to work with your prescribers, to go through the different options, to talk about them, to set the expectation on the percentage of efficacy, what are the side effects, and then decide on the pros and cons of those treatments. But definitely we have good hope of bringing better control to alopecia areata patients.
Thank you so much for that. Dr. Ferguson, how about you? When you have time with that patient, how do you help them set those realistic expectations to navigate the unexpected when dealing with something like alopecia areata?
Well, I'm just really appreciating Dr. Ringuet's sort of holding that sense that it is unpredictable and just being transparent about that, saying, there are risks here. We don't exactly know what's going to happen, just like in life. Here are some of the parameters. I think being truthful with people makes a big difference. And at the same time, holding that there's hope. So I think those two things that I'm alongside as your physician or as your therapist, we don't exactly know how it's going to go, but you have company. You are accompanied by someone who cares, and we have some hope. Those two things calm the nervous system so much. You can just feel like, okay, I can trust this person. Maybe the process is going to be unpredictable and it's going to take some twists and turns, but I'm not alone.
So true. Thank you for that.
Nazin, I have the same question for you. As a person living with alopecia areata, how do you or how have you managed those expectations for yourself? And how has your care team helped with that?
Yeah, of course, that's a very great question because I believe everybody who is going through that should definitely know what are the best ways for them to be able to get through this condition and just come out of it stronger than before. And for me, as I said before, when I started losing my hair, I was very embarrassed by the way I looked. So I decided that that I cannot go out with the way that I just, my hair looked or my eyebrows were falling out. And so this kind of made me want to learn how to do makeup. And before that, I never did my makeup. I never knew how to do my makeup. And this really allowed me to experience with different things and just buy makeup and learn how to do my eyebrows and learn how to do my eyeliner. And that was really great because I was able to regain my confidence. And that was something that I definitely have lost when I started losing my hair. So it was something that not only I lost my hair, I started losing my confidence as well. So being able to just do my makeup and feel like I'm a woman again, that really was something that helped me get through the hard times. And of course, this made me feel a lot better about myself, way better for the way I looked as well. And another thing is that stress management. One of the biggest things for me was that I believe that I started losing my hair because of stress. And during the time that I was first undergrad, my first year of university, I was in a lot of stress. So that was something that made my body at least not be able to handle the stress. So I started losing my hair because of that. And through this experience, I really learned how to manage my stress. And some of the things I do to really help me with that is, of course, meditation. That is something that for me have worked really well. Meditation and also working out, because my body is able to release that kind of stress through being able to breathe faster. My heartbeat is faster. And that's really great because I'm able to receive that oxygen that usually just my brain isn't really getting from just stressing. And of course, another thing is that talking to people and talking to my family, talking to my mom, talking to my dad, and talking to my best friends really, really helped me get that anxiety out, get the feeling of nervousness, feeling of loneliness, as Dr. Ferguson talked about. And we all have this resiliency in us as alopecia patients, as patients that are going through immune diseases. And just knowing that we are resilient and we are able to get through this, we can definitely come out of this stronger than ever. And I really feel like I am more confident and stronger than I ever been. And even though I've been through all of this, I'm very, very happy with all the experiences I've had just because I came out of it a lot stronger.
Nazin, I just wanted to thank you so much for sharing that. And I actually have to ask Supriya the same thing is how did you regain your confidence, after hair loss? Can you relate to what Nazin has said in terms of how you manage stress? And just the more things we share, I think for patients, the better.
Yeah, I'm feeling very inspired by Nazin's story, and I know our podcast listeners can't see you, but I have to say your makeup is immaculate and you're beautiful.
Thank you.
So you're really owning it, and I'm so proud of you for doing things that gave you your confidence back. Alopecia takes so much away from us, and you said, no, I'm giving myself my confidence back, and that is so awesome. So I'm very proud of you. And, for me, I relate so much because when I started losing my hair, the first thing I thought was, I hate the way I look. I hated looking in the mirror. I felt like I was a stranger to myself. I didn't know who this face was. I lost my hair when I was 32 years old. So I had one face for over 3 decades. And then all of a sudden it was just this stranger. And I hated this version of me for so long. And I think the thing that helped me the most is, honestly, I had a very life-altering moment in 2017 when I had a really large blood clot in my lungs. And that kind of just opened up my eyes to how short life can really be. And I had this moment as I was coming to my 35th birthday where I was like, either I can continue to be so depressed about my hair loss forever and just live in misery until the end of time, or I can acknowledge the fact that my life could have ended with that blood clot and it didn't. And so I'm tired of being miserable. I'm going to start living my best life. And that's really how I built that bridge to peace. I decided I wanted to live this life I've been gifted with. Not everybody gets to wake up tomorrow. So that's really where my mindset shifted.
Thank you so much for sharing that, Supriya. And really, I can't say thank you enough. And the same to Nazin. It's been such an incredible discussion. I think it really goes to show the team-based approach is really a way to go in terms of supporting patients, with alopecia areata, and it can definitely lead to improved outcomes for them. And as we've done in previous episodes, since we're at the end of our conversation, we'd just like to ask you one last question. So I'll ask our two healthcare professionals, starting with Dr. Ringuet. Keeping in mind what we've discussed today, what is one word or phrase of advice you would want our listeners and fellow alopecia areata patients in Canada and around the world to remember?
Thank you, Adam. So yes, I'll do one sentence and one word, all right? So that one sentence would definitely be alopecia areata is more than just hair loss. As we've discussed today, it can have a significant impact on mental health, productivity, work-life balance, your relationship with other people. And again, there's also this functioning part. Hair and eyebrows and eyelash are important for communication and self-image, and severe disease definitely distort this part. So that's the very long sentence that I bring forward, and the word would definitely be hope. There's more and more awareness of the disease, its impact on life, and that led to the development of newer treatments that are available, let's say right now in the US and coming to Canada, and newer ones are coming with unprecedented efficacy. So when a disease control is expected by the patient, we do definitely have newer options.
Thank you so much. And how about you, Dr. Ferguson? What is one word or phrase of advice you would want our listeners to remember?
Well, I want to pick up on something Nazin said when she said how important it was for her to keep talking. I think sometimes when we're going through something difficult, particularly where you start to sort of self-isolate, kind of pull back, you stop talking, you stop communicating in that sense. And so I would want to encourage everyone to keep talking, particularly patients, to keep talking about what's going on and be willing to say it out loud and to find people who will listen to that. And those of you who are alongside, keep listening.
Thank you, Dr. Ferguson.
And Nazin, same question for you. What would be your one word or phrase of advice that our listeners and alopecia areata patients around the globe should keep in mind?
Yes. So my word of advice, my sentence of advice actually, would be that you should know that hair or no hair, you are beautiful and you should own the look, because you never sometimes get the chance to actually shave your head. And for me personally, I knew that I loved my hair too much to shave it. And going through this experience actually made me open up my eyes. And actually I saw the way that I can look without my hair. And maybe it's not that bad actually. So you just need to look at the life very positively and just enjoy every moment, because you can always get to where you want to be just with a little bit of effort. But you know that the way that you look will never get into the way of getting what you need. And for me personally, I want to go into optometry school. So let me tell you that you can always do what you want to do, but you just need to be confident and you need to really love yourself to be able to do the things that you love. So I really hope that everybody is able to do that and ask for help, of course, and just be confident.
Wow. Thank you so much. And thank you to Dr. Ferguson and Dr. Ringuet as well. Nazin, I think those are kind of perfect words to take us out for today. But I would just ask, Supriya, what was your big takeaway from this conversation?
I mean, I had so many. This was so amazing. I think, just hearing these final comments, when Dr. Ringuet says alopecia areata is more than just hair, I mean, I want to scream that from the rooftops, because nobody can prepare you for losing your physical identity one strand of hair at a time. And there's so many facets of your life that impacts. So I love to hear a medical professional also reiterating that. It's such an important message. I love that Nazin and Laurie reiterated keep talking, because that's also so important. I think when it comes to your hair, oftentimes maybe you feel scared to talk because a lot of people say, oh, it's just your hair, it's fine. At least you're not dying. At least it's not this. At least it's not that. And so you just want to go into this little shell and not talk to anybody. everybody. And so I love the message of keep talking. And if the people in your life are not allowing for that, then set those boundaries and choose the people in your life that love you the way Nazin's family and friends do, because that's what everybody with hair loss deserves.
Couldn't agree more. Thanks again to all of our guests. And that brings us to the end of this episode of From Hair to There, a podcast about alopecia. This podcast was made possible with support from Pfizer Canada. We hope the stories, insights, and voices we've shared have touched you, educated you, and made your journey a little brighter.
Living with alopecia areata is more than just hair. It's about resilience, identity, and community. And together, we're building that community, one story at a time. If our words resonated with you, please take a moment to rate us, leave us a glowing review, and share this podcast with your friends, family, and networks. Every share amplifies our voice and helps someone out there feel understood. And if you have any questions, comments, or episode topic ideas, you can email us at podcast@ghlf.org.
And remember, whether you're on the path of acceptance, seeking treatments, or anywhere in between, we're with you, from hair to there.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.